All right, so let's take a look at this sagittal view of the head and neck, okay? When you inhale, air goes in through your nasopharynx and or your oropharynx. Either way, the air ends up in the back of your throat, which is called the pharynx, all right? And it should go down your trachea. Trachea is a tube that is surrounded by cartilaginous rings and splits off to your lungs. Okay, so air goes in through your nasopharynx, oropharynx, goes to the back of your throat, pharynx, down past your larynx, which is the voice box, in between the vocal cords, through the glottic opening, and down to the trachea, which is surrounded by rings that keep it open, cartilaginous rings, and then we go into the lungs. Okay, so we only want air going to the lungs. And the reason that we have a trap door here called the epiglottis, which is above the glottis, is to close the opening to the larynx, to close the trachea off when you're swallowing food. Okay, now posterior, so that's anterior. All right, anterior is in this direction. Posterior is in this direction. Now, posterior to the trachea is the esophagus. And the esophagus goes through the diaphragm. And now we end up in the stomach. Okay, so we want food to go down the esophagus, into the stomach, and then here is the small intestine. Okay, so this is how a normally functioning, anatomically functioning human being should take in air and take in food. Now the problem arises when the patient goes unconscious, and now our patient is supine. So we still have the nasopharynx here, and we still have the oropharynx here, and we still have the pharynx here. The only problem is that the tongue in your unconscious patient will most probably slide posteriorly, because now anterior is in this direction, posterior is in this direction. So the tongue is going to slide posteriorly and occlude the airway. So that's why we need to drop an oral airway in the oropharynx or nasal airway in the nasopharynx, and those will then prevent the tongue from occluding the airway. Okay, so you have a choice of either an oral airway or pharyngeal airway or a nasopharyngeal airway. You're not going to want to use the oropharyngeal airway in patients that have an intact gag reflex. Okay, that's basic airway management. Then when you have an airway in place, we can then assess to see whether or not your patient is breathing. If they are, the first 30 seconds is done. If they're not, then we have to breathe for them with a bag valve mask.